Hello, everyone. My name is Natasha, and I work for Campus Progress with all the wonderful people that are putting on this event for you today. As an advocacy associate at Campus Progress, I work to engage young people on local and national issues, including healthcare. In fact, I've been spending much of my time recently tracking the healthcare debate that's going on in Congress right now. You know, it's said that young people may not really care about healthcare, that it's not really the issue of our generation. Well, I know that that's why all of you are sitting in this room right now, to show that, in fact, you do care about these issues, especially this dire issue that is affecting our nation's health, our economy, and our future. Ladies and gentlemen, I am pleased to introduce someone to you that is ready to fight for healthcare reform right along with us. She has over 20 years' experience in state government and has been a leader on healthcare issues for over a decade. She was first elected as the governor of Kansas in 2003 and was reelected in 2006. She now comes to us from the White House. Yet while in Kansas, she worked tirelessly to grow the state's economy and to improve access to quality and affordable healthcare for all. While governor, she put an emphasis on childhood immunization and increased eligibility for healthcare coverage for children. In fact, 59,000 children were enrolled in healthcare while she was in office. In 2005, Time magazine named her one of the nation's top 5 governors. Prior to her tenure as governor, she spent 8 years serving as the Kansas State Insurance Commissioner, where she helped save senior citizens $7 million on prescription drugs. She also drafted a proposed Bill of Rights for patients. She is the leader of one of the largest civilian departments in the federal government and the principal agency for protecting the health of all Americans. Please join me in welcoming the Secretary of Health and Human Services, Kathleen Sebelius.
Hello, Campus Project. How are you? Are there folks here from the Sunflower State? All right. Then we're all right. People from the Heartland are here to protect you. Well, I appreciate Natasha's warm welcome, and I want to thank all of you for being here today. This seems like a terrific program, and I know you have an opportunity to hear from an array of great leaders, and I'm happy to be a bit of a warm-up act for Speaker Pelosi and former President Clinton, who you get to hear from later today. But I'm glad to appear close behind Van Jones, because I think there's no question that two of the fundamental issues we're dealing with on the horizon that will make probably the biggest impact on the 21st century are what America is going to do about climate change and whether we're going to assume a leadership position again and join with the rest of the world in saving our globe, and what we're going to do about our healthcare system. So it's pretty appropriate that we talk back to back. You know, I had a great opportunity last year to spend a lot of time on the campaign trail, campaigning for now President Barack Obama. And what I saw across this country is an unprecedented number of young people who stepped up. And in spite of the fact that there were lots of doubters out there who said, you know, young people won't organize, they won't register. If they register, they won't show up, they won't vote. And frankly, your generation defied all the odds. You elected the President of the United States of America, and I want to thank you for that on behalf of all Americans. And America will never be the same. We have begun a new chapter in this country just by the person who is now representing us as the leader of the free world. And I think it's an enormously exciting opportunity. But I also want to thank you all for being here today to learn what you can about ways to continue that progress, because elections are one step, but the most important step is what you do after your election, how you govern, what kind of difference you can make. They say there are people who run for office because they want to be somebody. There are other folks who run for office because they want to do something. And I think we're definitely in a phase of doing something and trying to make a huge difference. In healthcare, there are some very serious challenges facing us. And the bottom line is the status quo is not good for anybody. We can't sustain the status quo of the health system any longer. The costs are skyrocketing. We spend almost twice as much as any nation on earth for health insurance, and yet our health results don't show it. We continue to lag behind most of the developed world in every measure, from infant mortality to life expectancy to diabetes rates to heart attack survivors. And frankly, the levels of obesity in this country are growing at such an alarming rate that we have the first generation of children in America where, if these trends continue, they will have shorter life expectancy than their parents. Here in America, the first generation who won't have a longer lifespan. And that's a pretty terrifying health fact to face. So the president talked about this issue a lot during the course of the campaign and came into office really determined to start to do something right away. Without the passage of any bill in Congress later this summer, there's already been more activity on health care this year than in the last decade. And let me just tell you about a few of those building blocks for health reform. The second bill the president signed was the expansion of the Children's Health Insurance Bill, enabling 4 million additional American children to be enrolled in health insurance. So 11 million children in this country who didn't have insurance prior to the passage of the legislation now will have health coverage, and that's very good news. They'll get early checkups, they'll get immunizations, they'll get early interventions. What we know about kids is if you show up in kindergarten and you're not healthy, you can't learn. So having those doctor appointments, identifying everything from whether a kid needs glasses or has a hearing problem early on and getting that corrected means that not only are they going to be healthier, but they're going to be better students. When the economy started to turn down, part of the Recovery Act was about health care, ensuring that states who have the safety net system for lower income Americans could continue to protect that system. So additional money for states to help with the Medicaid budgets. Additional money was put forward for those Americans losing their jobs so they could have their employer-based coverage continue with some help from the federal government, the COBRA coverage. And we know that we now have 12,000 Americans every day losing their health coverage. So those additional benefits are huge to make sure that the current system isn't further eroded. Even without those 12,000 a year, we have about 46 million Americans without health coverage at all. And those of us who have health insurance are teetering at the edge with costs that continue to rise. More out-of-pocket costs, higher deductibles, more rules by insurance companies that block people from coming into the market if you have a pre-existing health condition. A lot of you may be covered right now in a college plan or may be on your parents' plan. My sons are 25 and 28, and I can tell you as a parent, it was pretty terrifying to watch them get beyond either a college plan or the kind of plan that we could enroll them. Because one runs a small company on his own, he's an entrepreneur, and he is the employer, and the other one went back to graduate school, and both were in a situation where there was no employer-provided health coverage. There was no group to enroll in. And we see that all over America with younger Americans who have to really choose about paying the rent or making your student loans payments or purchasing insurance. And for a lot of folks, they take a chance. And they say, you know, I'm young and I'm healthy and I'm going to go without coverage, which means you're a accident away or a step away from what could be hundreds of thousands of dollars worth of medical bills, debt that will follow you for the rest of your life. And we see that happening each and every day. So the current financial situation we know is unsustainable. Our businesses are less competitive because they're competing with global rivals who don't bear the cost of health insurance on the individual products. It's crushing family budgets, it's crushing small business owners. So lowering costs for everybody is essential. The president also has tapped into a lot of the stakeholder groups. In the early 90s, the last time comprehensive health reform was really discussed in this country, by this point in the discussion, there were already mobilized opponents from doctors and hospitals, the major insurance companies, the major drug manufacturers. And in that debate, it became clear that doing something was scarier than doing nothing. And doing nothing won at the end of the day. That the status quo was seen as a more productive pathway than change. Fast forward to 2009, we're no longer in that situation. I don't hear anybody really talking about the fact that what we're doing day in and day out, paying lots more than any country on earth, getting worse results, and continuing to see costs skyrocket. I don't hear anybody saying that that's a really good strategy moving forward. It will bankrupt governments, it will bankrupt families, it will bankrupt businesses, and it doesn't produce good results. So it's the classic definition of insanity, doing the same thing over and over, expecting for a different result. That's really the pathway we're on. But the good news is I think Congress is truly engaged. We have an unprecedented amount of cooperation and collaboration in the House of Representatives. There are 3 different House committees with jurisdiction over health care. And I don't think ever in the history of the House of Representatives have those 3 committees made a deal at the beginning of a debate that they will come forward with one bill. They would work with one another and kind of cede jurisdiction and work on a single piece of legislation, and that's what's going on right now in the House. On the Senate side, you have Republicans and Democrats working in the Finance Committee and the Help Committee, and again, there is an enormous amount of not only work going on, but discussion and collaboration and cooperation about a comprehensive reform aimed at making sure that all Americans have health coverage, making sure that costs come down for everyone, that we rein in the spending that we have right now that doesn't really produce higher quality. It's just about quantity of medicine delivered, more tests and more procedures, but not necessarily increasing the health outcomes for our citizens, and changing the entire system from a sickness system to a wellness system. Right now, again, doctors and hospitals' payments are based on what happens when their patients get sick. But we do very little, 8 cents on every healthcare dollar, to encourage anybody to keep people well, to address the underlying conditions that cause chronic conditions, obesity and tobacco use and nutrition. Very little to encourage exercise in kids or to work with schools on what's in the school cafeteria, the fact that PE was cut out of many classrooms years ago, and so we have a generation of couch potatoes who thinks the exercise comes from the digits on their thumb instead of jumping up and down a little bit. Those strategies are not good for our workforce, they're not good for our healthcare costs, and they're really not good for this country. So they need to change overall. When the president determined that this would be the year for healthcare, he took a bold risk. There were lots of folks who said, you know, the economy is not doing very well, and you really need to put this off and work on some other issues, or, you know, there are lots of other challenges out there. This can wait for later in your term. And what he determined was that you can't fix the economy without fixing health care. It's about 16% of our overall GDP right now, but it's on a rapid rise, and that we really can't get back on track economically. Families can't get back on track unless there is some security and some overall health care. So the plan that the President is pushing is aimed at bolstering and stabilizing the employer-based coverage that people have. About 180 million people have jobs that are connected with their health insurance. Their employers provide that coverage as part of the benefits. And for most of those folks, it's great coverage. It's family relationships with doctors that they like. The coverage does well for them and their families, and the President doesn't want to dismantle that system. But then there's a whole group of people, the so-called underinsured, who have some kind of coverage. If you get hit by a bus, you may be able to pay those hospital bills or have catastrophic illness, but it really doesn't cover the kind of day-to-day expenses that families experience. So if your kid falls on the playground and breaks his arm, or if you are involved in an automobile crash that requires a brief stay in the hospital, you're going to be paying thousands of dollars out of pocket, and often thousands of dollars that people don't have in their savings accounts, so they go into debt. And that's why half of the bankruptcies in this country are based on health-related situations, because people just can't afford to pay those bills. And then there's a whole final group of folks, 47 million, who have no coverage at all and are coming through the doors of emergency room to try and access basic medical care. Now, that's not good for the hospitals because they lose millions of dollars every year. It's not good for any of us who may get sick and require that hospital care, because there's a lot of medical attention in hospitals being focused on delivering flu shots and treating people with sore throats and trying to deal with minor health incidents because the folks don't have a medical home. So that entire system needs to be reformed and revised, and that's really what the legislation in Congress is all about. The additional pieces beyond the children's health insurance bill that's already passed and the help for people to keep their employer-based coverage, which is passed, is health information technology. Think about your last visit to a doctor's office when your file is still in a paper chart where when you went in, you were probably asked for the 11,000th time to fill out a form that asked for your name and what address you were, and if you had an insurance card or not. And that exercise is being replicated over and over and over again. This is the last profession in America to be introduced to technology. As somebody told me the other day, we're still using the same methods that Hippocrates used in just a little while ago. We have to update the health system and bring them into the 21st century. And a lot of it is not just using computers instead of paper. It's the kinds of things you can do with an electronic health record, filling out forms once for a doctor and billing the various insurance providers as opposed to over and over again, which saves enormous amount of time and an enormous amount of money that medical provider can spend treating patients. It means that if you're in the hospital, you don't get the wrong medication, which happens a lot, because there are ways to make sure that your medication matches your patient record. It means that when you leave the hospital and somebody orders a prescription, that prescription is automatically sent to the pharmacist, and they can check and make sure that it isn't counterindicated, that you won't get sicker from taking the prescription than not taking it. It means that we can lower medical errors, which produces healthier patients, but it also dramatically reduces costs. So health technology is also part of this strategy and was implemented as part of the stimulus plan and is a way to begin, again, to transform the system. So there's an enormous amount going on right now in Congress and throughout the administration dealing with health reform. The President believes, and I believe, that this is the time, that this is the opportunity to finally bring about the kind of change talked about beginning in Harry Truman's days and for the last 50 years, where people have been trying to address this issue, that we have an opportunity for comprehensive reform that not only will be good for the health of Americans, but frankly, good for the wealth of Americans. It will move our country in a healthier and wealthier direction. Now, I love being governor of Kansas. Being governor, by the way, if you're thinking of running for political office, that's the job you want. It's a great job. So I really wasn't eager to leave that job. And when the president talked to me right after the election, the president-elect at that point, about coming into the cabinet, I told him I really couldn't do that. Asked that my name be taken out of consideration. Told him that things really weren't going so well in Kansas, that we were seeing some beginnings of bad budget times, and I really needed to stay and make things work in our state. So about 4 months later, after he had become president and some things transpired, he came back and talked to me about being the Secretary of Health and Human Services and said to me, you know, Kathleen, in case you haven't noticed, things aren't going really well in the economy of the United States of America. And the last time I looked, Kansas is part of the United States of America. So maybe there's a way that you could help Kansas and help the United States at the same time. I have to tell you, leaving that office was not an easy choice, but the opportunity to be here at this moment in history, to head the agency in charge of improving the health of all Americans and delivering essential services to our most vulnerable population, is an opportunity that I couldn't say no to, and a challenge I couldn't refuse. And I hope that those of you who are here for a few days or for the summer will continue to be involved and engaged in this issue. This actually, the debate in Congress on health reform, has a lot more to do with your future in many ways than it does with mine, because it will determine a lot about our economy for the future, and it will determine a lot about not only your health, but the health of your children going down the road, and whether or not we're able to really deliver on comprehensive reform and move America in a new direction. So again, I want to thank you for being here, participating in this program, but I hope you will have your voices heard. I hope you will weigh in. We are in the midst of the hand-to-hand combat in Congress on health reform. This is the time to let your members of Congress and senators know that this is a priority in this country, that not doing anything is not an acceptable alternative, that we can't sustain the status quo, that it's unacceptable, unsustainable, and frankly, as a moral issue, it's unconscionable. So this is the time to move in a new direction, and I hope you'll help us get there. Thank you all very much. Thanks.